Welcome, everyone. I'm Dr. Ward Bond, and I have with me none other than one of the icons of the industry, as well as the whole area of natural health, Dr. Elson Haas, who actually wrote one of the most iconic books, and your host has read this book from cover to cover, Staying Healthy with the Seasons. And we're also going to talk to him about his brand new book, Staying Healthy with New Medicine. Explain the word new medicine for us.
Well, NEW is an acronym. I love acronyms.
Yeah.
I have one for my detox book called The Snacks, I'll tell you that. But NEW stands for Natural, Eastern, and Western. And when I wrote this book after becoming a doctor and realized I knew very little about health, this is in the early 70s, I said I need to learn about health and healing. So where I went to was natural medicine books. There wasn't a lot out. Chinese medicine, herbs. I started learning about nutrition and detox. And I said, this is all really important stuff. This should be part of healthcare.
Yeah.
So I said, well, my folks were wondering what the heck I was doing after medical school. I said, I'm going to write a book and I'll help them understand what I've learned that I've brought together. So this book really integrates natural, Eastern, and Western approaches. And then after 40 some years of being a family practice doc, I realized there's a lot of philosophy that I want to give people as the basis for how to think about our health.
Yes.
And that's what new medicine is about. It's about looking at really causes of disease rather than just treating the end result, which is what many doctors do.
Right.
And so much of our health is really up to us, and my 5 keys that I have a whole chapter on here, 5 keys to staying healthy, are good nutrition, exercise, having a good balanced fitness program, getting good sleep, managing our stress and learning how to do that, which is the work because we're not trained in that, and keeping a healthy attitude. So the more love we keep in our heart, my motto in life is keep love in my heart, say yes whenever I can, but be able to say no. So learn what your limits are. I have to do that a lot with patients.
That's wisdom right there.
Yeah.
That's
wisdom.
That's deep wisdom. So.
And then also, I want to, I like being a doc still. It's fun for me to help people change their life and help them reverse many of the chronic diseases, which, Western medicine is focused on, and I am at Preventive Medical Center. The idea of prevention is, how are you living right now, and what's that going to do for you in 20 years? And if you're living in a way that's going to create diabetes and high blood pressure and high cholesterol and cardiovascular disease, well, if you change that, you can not create those things. You can lessen, either delay when you might get them if you're genetically potential, or you won't get them at all. And the whole area, and I have in a whole discussion of genetics and epigenetics, how we live influences whether certain genetic factors are expressed in our life. Just because your parents had something doesn't mean you'll get it.
Well, that's what I've always said, because some people tell me, diabetes runs in my family, heart disease runs in my family. I go, no, it was what your grandmother was cooking, that your grandmother still taught your mother, that your mother taught you. Right. That's what's hereditary, is usually the eating habits.
Yeah. So I tell people a lot, and I talk about that in here too, a lot of things are familial. In other words, they run in families because people have even sometimes the same emotional ways to deal with life,
Right.
Or the same attitude is like, it's going to screw me over, so.
Being paranoid and thinking somebody's going to do you wrong all the time.
When I did it, my life changed when I did a 10-day fast, which I wrote about in here back in the mid-70s, and I realized I didn't learn any of this in med school. My body changed. Like my 20 years of allergies cleared up. I dropped weight. I started to feel healthy and vital. I said, well, and at 27, I'm saying, this is not how I was feeling, and I'm young. It should be great.
Well, you're actually one of the lucky ones that actually got to figure this out before you went into full-blown medical practice, because a lot of the doctors, they go through medical school, they're an intern at a hospital, they go through the whole system, they only know the system, and then they find this out, 40 years down the road.
Right. Yeah, it was really, I had to look at myself in the mirror and say, look, you're not very healthy, and you should be. Well, what's going on? So I started to say, you're my first patient. I told myself that.
Oh, that's good.
And I did cleansing, and I got into what we call the back to, people looked at this is the back to nature book.
Yes.
It's like, pay attention to the cycles of life, the seasons of the year, eat from nature and the gardens and the orchard, get away from all the junk you're eating, be outside, stay tuned, get proper sleep in the winter, cleanse your body in the spring, enjoy yourself in the summer, all these simple things that I write about on my websites and, been my main message. It's the simplest message about health. Really.
Yeah, it is. It is. And now, you were saying something earlier about what is snacks. What does that stand for?
So my detox diet book is one of my more popular ones because most everyone needs to detoxify at some level. And that simply means get away from the junk and chemicals and things that you're using and eat wholesome food, okay? In here I have a whole chart on the causes of disease. In the center of that chart is the cell. And the way we get out of balance from a cellular point of view is we're not getting all the nutrients, the vitamins, minerals, amino acids, fatty acids, and the phytonutrients from real live food to nourish and get all those functions that we do. And we have toxins, metals, and chemicals that get in our air, food, and water that interfere with cell function. So when I first see people, I'm always looking at what are your daily habits. And I came up with this acronym called SNACC. SNACC stands for sugar, nicotine, alcohol, caffeine, and chemicals. So when I interview people and go through, I have a questionnaire in the back of this book that I so use for my patients. Okay, yeah, they have 2 to 3 cups of coffee a day, they have 2 glasses of wine, they have some sugar. So I'm working on a program now, I'm starting to do digital courses. One is called, and I think this is really key for the country, for people to make a change in their health. Yeah. It's called Regain Your Natural Energy.
Wow, that is important.
Basically clearing the stimulation-sedation cycle. Most people, the most common symptoms that a family doctor sees, like myself, are fatigue and insomnia. We don't have the energy they want, or we're not sleeping well, and then we wake up and we're tired. So many people take caffeine and sugar to get their energy going, and take something at night. Either they're puffing on, different funny cigarettes, or
alcohol,
or alcohol more typically,
or some type of chemical, or maybe a prescription.
And
chemical.
so when they do that, we're always managing our mood and energy. And if we don't do it well, we don't sleep well one night, then we don't feel good, and we're doing maybe a little extra shot of coffee that day, and we're wired and tired at night, and it's a vicious cycle. So breaking the stimulation-sedation cycle, I think is crucial, and I got an online program starting that guides people day to day on how to do it. That's what people have asked me for. It's like, just, I want to know how to do this. Make it simple, Doc.
Now, can anyone go to your website at elsonhaasmd.com
Correct.
and actually go through that questionnaire, so to speak?
They can go through the 5 keys to staying healthy. They can go online. And into the course, Regain Your Natural Energy. There's a free course on 5 keys to staying healthy. So it really coaches people on, this is the only body I have. I got to treat it with love.
Yes.
And so that means choosing good foods, which we have the greatest control over, making sure we follow the 5 keys, because then you're going to be healthy like me and you feel.
That's it. I can tell you what, ladies and gentlemen, go to elsonhaasmd.com, learn more about better health, natural healing. And I can tell you one thing, you've got to start off with Staying Healthy with the Seasons, his original book, and also the brand new one, Staying Healthy with New Medicine. Get them both. And go through some of those questionnaires and learn something about your body and the changes you can make to make you feel better. Just imagine waking up in the morning and actually having natural energy like you've never had before, without ever touching a cup of coffee, without taking any type of stimulant whatsoever. And not only that, how about going to bed, falling asleep and staying asleep the natural way, the way God intended. And guess what? That's how we are supposed to be. And if you're not feeling that way, elsonhaasmd.com, check it out. And I can tell you one thing, if you live in Northern California, this is your doctor right here. We'll be right back.